Okay, today we're going to talk about fractures. Fractures have been defined as a break or crack in the bone and are most common in collision type sports such as football or soccer. Now, it's not limited to those sports, but that's where it's most common because they're collision type sports. Fractures can be classified in one of two ways: simple or closed fracture. Both ends do not break through the skin, and you'll hear me refer to it more as a closed fracture. Then you have compound or open fracture. Bone ends breaking through the skin. I usually refer to those more as a compound, and that's just my language. It doesn't make either one wrong. That's just how I refer to it. Compound fractures are potentially more serious because of the risk of infection related to the open wound. When that wound is open, air can get in, bacteria can get in, germs, so you have the risk of infection when that skin is open. Also, the need to control the bleeding may be evident considering where the injury is located at. You may have to control bleeding. Obviously, you're not going to do that with your bare hands, but you want to find some cloth. Usually, if you can find something that's like a germ-free, that's possible, but sometimes you just have to use what's around depending on the situation and where you're at. Acute fractures, although relatively uncommon in sports, need to be treated appropriately to prevent complications such as shock, excessive blood loss, or permanent damage. Acute fractures that happen immediately within, at the moment to within 24 hours. That's an acute fracture, something that happens all of a sudden. Signs and symptoms of a fracture. Swelling caused by bleeding. It occurs rapidly after a fracture. Deformity. This is not always obvious. Compare the injured with the uninjured opposite body part when checking for deformity. Pain and tenderness, commonly found only at the injury site. The athlete will usually be able to point to the exact point of pain. A useful procedure for detecting fractures is to feel gently along the bones. And then what happens is the patient usually complains of pain or tenderness severe as a reliable sign of fracture. So basically, the more severe the pain, the more likely it is a fracture. Now, I'm not going to go and say that every time that you feel around that somebody's got a fracture, because sometimes you can have a bone bruise. So there's some other things you can do to detect fractures, but that's one way that you can kind of suspect a fracture if you're looking for one. They'll have loss of use, the inability to use the injured part. They won't want to use it. They won't want to step on a broken leg. They won't want to use their hand. Guarded motion occurs because movement produces pain. Nobody likes pain, so they want to do the thing that causes the least amount of pain. And the athlete will refuse to use the injured limb. However, sometimes the athlete will be able to move the limb with little or no pain. So sometimes they can move it even though it is broken. Grating sensation. Do not move the injured limb in an attempt to see if a grating sensation called crepitation, if you remember that from your vocabulary. You don't want to move it so it can be felt. Sometimes you can even hear it when the broken bone ends are rubbed together, okay? That's that crepitation sound, but you don't want to try to produce that on purpose. You want to check for the history of the injury. Look at the mechanism. What caused the injury? If high forces were involved, then suspect a fracture. Okay, anytime you have high speed, intense forces, that could cause a fracture. Also, ask the athlete if they felt a pop or a crack. That can tell you a whole lot too. Okay, types of fractures. You have an open fracture right here, obviously where it's coming out. You have a closed fracture right here because it's still inside the skin. Incomplete fracture because it did not go all the way through the bone. Complete fracture where it goes all the way through the bone, not necessarily both bones, but it goes all the way through the bone. Displaced fracture. This is not a great picture, but a displaced fracture is when those bones are not lined up and they come out of an alignment, a normal alignment together. Then you have a comminuted fracture right here, which is when you have little pieces of a fracture. Right? Here's an impacted fracture. That's when the bone breaks and one end slides over the other. You have a spiral fracture, which kind of makes a twist up the bone. Transverse fracture, which cuts across the bone. You have an oblique fracture that kind of goes more at an angle. Obviously, you're showing here, once again, a complete fracture or an open fracture where it comes through. And then you have, once again, your comminuted fracture, which is there's little pieces, once again, little shards of bone. Right here, you see what they call a green stick fracture, okay? Green stick meaning like a green limb or twig off of a tree. When you try to break it, it doesn't break all the way, it just kind of splinters. So you get this, the bone bends and you get this splintering right here. And if you look, there's the fracture lines right there that show that splintering effect. Green stick fracture. Right. Here's an oblique where it's kind of at an angle and it's also displaced. So it's an oblique displaced fracture. This one is of a femur right here. Or here's an ankle, and this is a comminuted fracture. See all the little bone pieces and shards in the x-ray? That makes it a comminuted fracture. Here's a tibia fracture, and this is a transverse because it's almost straight, but it goes all the way across. Next, we're going to talk about stress fractures. A stress fracture is typically linked to sport because it develops over a relatively long period of time, as opposed to other fractures caused by a single trauma. You can almost classify a stress fracture as a chronic injury, meaning it happens over a long period of time. Stress fractures occur when one is subjected to repeated episodes of overloading, stress, that exceeds its rate of recovery, meaning if it's there and you continue to put pressure on it, a lot of times like in running because you keep going and it just doesn't seem to get any better. In fact, it gets worse because it can't heal itself. In effect, the bone starts to break down and eventually begins to fail. Once again, because it can't heal. Because stress fractures take time to develop, the signs and symptoms are easily confused with less serious sports-related injuries. Sometimes you can think they're a sprain just because, oh, there's not a lot of conclusive evidence, so you just kind of go on. But you don't want to overlook this, especially if it continues to nag and nag and nag for a long period of time. This is especially true when concerning stress fractures of the lower leg. Shin splints are often confused with stress fractures. So you've got to know what you're looking for in those situations. We're not going to get into depth with that, but you don't want to get those confused because stress fractures have to be treated differently than shin splints. So here's your signs and symptoms of stress fractures you're going to look for. First of all, your pain and tenderness. Athlete complains of pain and or tenderness, a constant ache which is not relieved with rest. Especially when you see them in the feet or legs. When you get off your feet, if you have any kind of pain, it should relax, or if you're not moving, it should relax. But usually you get a throbbing sensation that doesn't go away even when you get your feet up off the ground and relax. You're looking for an absence of trauma, meaning a one-time event that caused a serious injury, such as a fracture when there is no history of traumatic event, yet the symptoms persist. Meaning you didn't drop something on your foot, you don't remember kicking anything, so there's no history of something bad happening to that area. Repetitive activity. Athletes involved in activity that subjects the suspect area to repeated stressful loads. Any time of lots of running, like cross country, track, soccer, those kind of sports that you're continually running all the time. Duration. Symptoms have slowly developed over a period of days, weeks, or even months. Meaning it, once again, you go back to that absence of trauma, meaning there's not a one-time event, but the symptoms have slowly developed, start getting worse and worse over a period of days or even weeks. So you have to look at those kind of things too. But here's the thing, stress fractures are even a difficult diagnosis for a physician. Most of the time you can't see them on an x-ray. Okay? A lot of times doctors then immobilize them with a walking boot, kind of looks like a moon boot, although I don't know many astronauts that wear a boot like this, but it always makes people feel stupid. But anyhow, you wear a boot or even a walking cast for a couple weeks. And what they do then is they go back and take an x-ray to see if there's calcification lines around that area where it looks like it's healing, and then they know that there was a stress fracture in there. MRI or CT scan may be used as well to assist in diagnosis. They can. Sometimes you catch it, sometimes you don't. But here is a stress fracture. And the only reason we know this was a stress fracture is you don't see any line here, but you see a small little bump right here, which means that there's calcium formation. So it's healing. That's the only way you know. Okay, we're going to talk about a Salter-Harris fracture. A category of fractures that is unique to adolescent athletes. This type of fracture involves the epiphyseal growth plate, meaning fractures where the bone is still growing at the growth plate. So you see this in young adolescent athletes who are still growing. These fractures can be classified based on specific location of the fracture and the structures involved. Right here is the end of the bone, and this is what you would call a epiphysis fracture, or Saltus Harris fracture, which is just straight across the growth plate. Then you get a metaphysis and physis fracture, where it breaks across the growth plate and then to the side. Here you have a fracture that goes to the growth plate and then goes to the end of the bone. Then you have one here that's epiphysis to metaphysis fracture, meaning it just cuts the side of the top of the bone off. And then you have the crushing fracture, which is type 5, basically where it smashes the growth plate. But these are all Salter-Harris epiphyseal fractures, okay? So meaning these are Salter-Harris. I'm not going to spend a lot of time on this. It's kind of in depth, but basically knowing that it's fractures through the growth plate are Salter-Harris fractures.